I'm Dr. Vivekanand, the consultant cosmetic surgeon at Fortis Lafarm, where I head the Department of Cosmetic Surgery and Hair Restoration. Surgical treatment for androgenetic male pattern baldness is indicated when medical treatment has failed to yield results, or when the patient has not taken a medical treatment and there is a large area where baldness is visible and it needs to be covered. There are two techniques for surgery. One is the older strip technique, and the second is what is called as the follicular unit extraction or the FUE technique. Now in our clinic, we follow the strip technique by using video microscopes to dissect out the hair grafts. So the procedure starts by removing a strip of hair from the back portion of the scalp. This strip of hair has got the hair and the hair roots inside it. The resultant gap in the back portion of the scalp is then stitched up. This leaves a small scar which extends from one end to the other end depending on the number of grafts that are needed for surgery. In our clinic, we follow what is called as a trichophytic closure, where we try and induce the hairs to grow through the scar so that the scar is as less visible as possible. Once the strip is removed, under video microscopes, we then dissect them into individual grafts. Now a graft can have one root, it can have two roots, or it can have three roots. If it has one root, it yields one hair. If it has two roots, it yields two hairs. And if it has three roots, it gives about three hairs. Depending on the location of the baldness, we then recreate the hairline. We put ones usually in the front portion of the scalp, and the twos and threes are reserved for the back portion of the scalp. So for each graft, we need to make one circular slit, and the graft is then pushed inside. So if you're looking at a 2000 graft surgery, we need to make 2000 small circular slits, and into each slit, these grafts are inserted. With a strip technique, up to 3000 to 3500 grafts can easily be removed, and they can be transplanted in the front. Even if you look at international statistics, 3500 graft is a big surgery and can cover a significant amount of your scalp in the first sitting. The advantages of strip technique is that it yields a higher number of grafts compared to the extraction technique. The grafts are cut as and how we want it under the microscopes, so the growth of hair is a little better in the strip technique compared to the follicular unit extraction technique. If you look at Asians, we can at the most remove up to 3000 to probably 3500 follicular units from a strip. It is very difficult to get more than that in majority of our clients. The advantage of using video microscopes for dissection of the grafts is that it becomes very small in size, and the smaller the graft, they can be densely packed to give better densities. The second surgical treatment that's available for hair transplant is what is called as the follicular unit extraction technique. Now basically in an extraction technique, we use a circular blade. This blade makes a cut in the skin, and then the graft is taken out to be transplanted into the front. In our clinic, we have been using NeoGraft since the last 6 years. We pioneered NeoGraft follicular unit extraction technology in India. We were one of the first few clinics worldwide to start with NeoGraft FUE technique. This has given us enormous experience in understanding the limitations of follicular unit extraction. Follicular unit extraction on the whole does not yield as many grafts as the strip technique, because for every single graft that is removed, we have to leave 4 grafts around it so that the scar of the FUE gets covered. In my clinical practice, we extract on an average anywhere between 1500 to 2500 grafts in a single sitting. If more grafts are needed, additional sittings will be required. So when you look at 1500 to 2500, it doesn't cover as big an area as compared to the strip technique. So it is ideal that whether it is a strip or an extraction technique, the choice is left to your doctor. Most of the times we have people who come and say, I want an FUE over the strip technique. But then we also have to look at the amount of hair loss that one has before you look at the technique. Because if you use FUE in a patient who has a significant hair loss in the front, then the results are going to be disastrous. There are two techniques in follicular unit extraction. One is the manual technique and the other is the automated technique. In a manual technique, we just use a rotary blade the blade makes a cut in the skin and in the graft, and then the graft is manually pulled out. This technique is slightly difficult, as if the operator is inexperienced, there is a high chance that the graft can be damaged. Which is why we chose NeoGraft, because in NeoGraft, the blade only makes a cut at the skin and the suction pulls the graft out, so we get an entire graft with very less collateral damage to the roots of the graft. So any clinic which uses the automated suction technique can give you better results compared to the manual technique in follicular unit extraction. Once you're done with your surgery, we normally do not bandage you. We put a small bandage only for the back portion, as there may be a slight oozing of blood-tinged fluid for the first 24 hours. Normally there is no pain in the front. If at all you have mild pain, it's usually in the back. Some patients tend to develop a bit of swelling in the forehead, which normally appears on the second or the third day, and it vanishes by 1 week. So at the end of 1 week, you almost recovered from your hair transplant surgery. We put you on antibiotics for 1 week and painkillers for 4 to 5 days. FUE technique has less pain compared to the strip technique, but the strip technique is not a very painful surgery per se, and most of our patients are very comfortable following the strip technique in terms of pain.